mode.
Good afternoon. On behalf of the Lupus Foundation of Minnesota, I want to thank you for participating in today's webinar, Understanding and Using Medication Wisely. My name is Sandy Parnell, and I'm the Director of Education and Supportive Services at LFM. I'm very pleased to introduce our speaker, Dr. Karen Bastianelli. Dr. Bastianelli is an assistant professor in the College of Pharmacy and Associate Director of the Pharmaceutical Care Learning Center at the University of Minnesota Duluth. Dr. Bastianelli also provides medication therapy management services in the community. Before Dr. Bastianelli begins, I want to highlight just a few things about how the webinar system works. At this time, make sure your webcam function is off. Turn on the mute function. Only voices you'll hear are mine and Dr. Bastianelli's. And your audio will be heard through your tablet or computer. We certainly invite questions during the presentation. You type them in the sidebar and I'll ask Dr. Bastianelli throughout the presentation. Also, we're recording today's session for future audiences. The recording will be archived on the LFM website. Following the webinar, you'll be emailed a brief survey. We hope you take a few minutes to provide your feedback as it helps shape our future webinar programming. And finally, if you'd like a certificate of attendance, please email me at sparnell@lupusmn.org. Welcome, Dr. Bastianelli. We look forward to your presentation.
Excellent. Well, thank you very much for allowing me to spend this time with you. Sandra, just so you know, I cannot see the slides or the questions being asked, so I will rely on you for that.
Sounds good.
Just to give a little bit of background, I am a community pharmacist who practiced for 13 years in the clinic situation and have been at the University of Minnesota teaching at the College of Pharmacy for the last 12 years. My focus is making sure that patients are self-advocates to getting the best health care that they can. And, I teach the pharmacy students that they can have all this knowledge up in their head, but if they can't translate it to the patient, to that person on the other side of the counter, it really doesn't mean anything. But we want to make sure that our patients get the best use out of their medications for the best possible outcomes. So my first question that I want to ask you is, next slide, how many of you know your pharmacist's first name? And I ask this because no one takes care of you better than you. And pharmacists are an excellent advocate and ally for patients. And it's really important to take that time to get to know your pharmacist and have them get to know you. So I strongly encourage patients to always go to the same pharmacy so that they have a chance to build that relationship with a pharmacist. And you'll see that it may seem that the pharmacists are busy back there counting, pouring, whatever it is that pharmacists do. But honestly, the best part of our job is talking to you, talking to patients, again, ensuring that you have all the information that you need to get the best action out of those medications that you're taking. And people are taking a lot of medications. Want to go to the next slide, please? Most adults are taking medications. It's hard to name a person who isn't taking a medication. And the other thing I want to make sure that you realize is that non-prescription medications count too. Things that you can get at the pharmacy or at the drugstore or at the grocery store, the gas station, those are still medications and they can interact with many of the prescription medications that you may be taking. So really important that you tell your doctor, talk to your pharmacist about all the medications that you're taking, both prescription and non-prescription. And you can see that lots of people are taking medications when you include all of those things into it. And really, for every medication that we're taking, we're increasing the chance of having a drug side effect. And these side effects can add up and actually cause more problems. So very important that you talk to your doctor, talk to your pharmacist about all the meds that you are taking. So next slide, please. Increasing the healthcare costs. Medications are there to help people, and they're also there to hopefully help decrease healthcare costs. But in the long run, as people are taking more and more medications, they're getting into more and more chances for side effects, and the side effects are what end up causing the adverse drug reactions that could lead to hospitalization. 4 out of every 10 people who go to the hospital, in those 4 cases, it's because of a medication that's causing the problem. So even though meds are there to help people, if taken incorrectly, they can cause more harm than good. And as pharmacists, we're always trying to outweigh the good that a medication can do versus the bad things that medications can do. So very important to, again, get into that thought of how can I best use this medication to get the best possible outcomes. The next slide shows just a graph depicting on how, as we get older, we tend to take more and more medications. So it's not uncommon for people to be on 5, 6, 7, 10. I've even had medication management sessions with patients who've been on more than 35 different medications. That's incredibly powerful, putting all those chemicals into a patient's body. Anytime you're putting a medication or a chemical into the body, you're going to have good effects and bad effects. And we want to make sure the good effects strongly outweigh the bad effects. But as you're adding more and more and more on, you increase that chance for side effects. And as patients are going to different specialists for different things, sometimes a lot of the providers lose sight of the fact of how many medications a patient might be taking. Again, that's just prescription medication. If you go to the next slide, just a friendly reminder about the over-the-counter medications that are out there. Any drug discount warehouse type place like Shopko or Walgreens or Walmart, you can get lost in the aisles looking at all the different over-the-counter products are there. And again, these are medications. They can interact with the different things, the prescription medications that you find. Next slide. That doesn't even include the natural products or the dietary supplements that people might be adding to their drug regimen as well. And again, these are chemicals. Even though they are quote-unquote natural, they still produce a chemical reaction in your body, and they could have a devastating impact with the prescription medications you might be taking. So again, very important to tell your physician, tell your pharmacist about all the different things that you're putting into your body, including the vitamins and supplements. I have a graph here saying that 75% of adults take at least one dietary supplement, and I would say that number is even low. I've never had a medication therapy management session where a patient hasn't been taking at least one other thing over the counter. So very important. We've got St. John's wort. This is one of the few nutraceuticals that has actually had some evidence that it can help with mild depression. But if you're already taking a medication for depression, you could actually get too much of this type of medication in your system, and it could be harmful. Anytime you have a chronic condition, whether it's diabetes, high blood pressure, lupus certainly fits in there too, it's even more critical that you talk to your pharmacist about all the different medications that you might be taking. So very important to always check in. And using medications properly is also extremely important. When a medication says it should be taken on an empty stomach, what does that mean? Usually I get a little bit of feedback when I do this in live where people will answer out when it is to take an empty stomach or have an empty stomach, but usually it's 1 hour before or 2 hours after eating a meal. That's when a medication that needs to be taken on an empty stomach should be taken. And that's not a problem if it's only once a day or twice a day, but if you have a medication that needs to be taken on an empty stomach 4 times a day, that could be really hard to do. At least I know it is for me. I like to eat. So the other important thing to ask is, doesn't matter if you need to be taking your medication with water, or should it be taken with milk, or is it okay to take it with coffee or whatever it is you like to drink? That's really important questions to ask. There are some medications that if you combine it with calcium from milk, the calcium will actually interfere with the absorption of the drug and it won't get a chance to get in and do what it's supposed to do. Perhaps you've heard about how grapefruit juice can affect some medications. There are some high blood pressure medications, antidepressant medications, and cholesterol medications, the statins, that if you combine it with grapefruit juice, it actually changes how the medication works and it could make it even stronger. So again, really important to talk to your pharmacist about the right way to take your medications. The other really important question to ask your pharmacist is it okay to combine your medications? If you have 4 or 5 different medications that you take in the morning, is it okay to take them all at the same time? And again, depending on what medications you are taking, that will change the answer. But in general, you shouldn't take all of your medications all at one time with 1 sip of water. It's best to take 1 tablet, drink a sip of water, take the other tablet, drink a sip of water, and separate out each of your tablets with at least a sip of water, and then also drink a full glass of water, at least 4 to 6 ounces every time you take medications. That helps the medications get into the system to dissolve the way they're supposed to do, get into your circulatory system so it goes where it needs to go. If you were to take all your medications all at one time with just a sip of water, what you'll find is that the tablets have a film coating on it that gets a little sticky, and those tablets can actually stick together and form a clump, and then they won't dissolve right in your stomach, or they could adhere against the stomach wall and actually cause an ulcer or a burn in the stomach and end up causing stomach bleeding. And so very important not to take them all at one time to form that clump. And that clump is one of my favorite pharmacy words, so I try to get it in as whenever I can, but it's called a Bezor, B-E-Z-O-A-R. Beware the Bezor. We don't want that Bezor forming in your stomach to help decrease how effective your drugs are going to be. So again, all those questions are really important to ask your pharmacist so that you can get the most effectiveness out of those medications. Just going a little broader, we have the Institute of Medicine. They have goals to help increase the effectiveness of medications in the healthcare system as well. And you can see there in bold that they strongly encourage patients to be active participants. Again, no one takes care of you better than you, and so the more you can do to get advocates on your side, the better your experience with the healthcare system is going to be, and the better care you're going to get. I know for myself, when I've had family members in the hospital or if we're going to the doctor, we always try to have another person with us. That person can hear things. Sometimes when you're under stress, you hear things differently than how they were actually presented. Or if you have a list of your questions before going into the providers, that can really help ensure that you get your questions asked. Many of the physicians and the providers these days have time limits on how much time they can spend with patients. And if you can be very efficient and make sure you get your questions asked in that short time you end up spending with the providers.
Dr. Bastianelli, let me interrupt you for 1 second and check and see if we're on the same slide. I'm on a preventable problem, improper medication use.
Okay, I am actually on to the next slide.
IOM goals.
Correct.
Excellent.
So the bolded sentences are the most important, in my opinion. Again, encouraging patients to be active participants. It's your disease, it's your body. You need to be the one in control, and you need to be working with your provider to find the best plan of action that fits your lifestyle, that fits the activities that you want to do, that fits your values and vision for yourself. So very important as patients that we work with our providers. It's not just them telling us what to do. It needs to be a conversation. So important to find that provider that you can build that relationship with in order to get the best health outcomes for yourself. And again, not only the physician providers, but also pharmacist providers. Okay, do we have any questions yet, Sandra?
No questions at this point. Thank you.
Okay, so let's move on to the traditional role of the pharmacist. I imagine that many of you have seen pharmacists back behind the counter counting and pouring and sticking labels onto bottles. And that's just a small part of our role as pharmacists, but that tends to be what people see. So what you have to understand is every time we see a prescription, we're always thinking four things: indication, effectiveness, safety, and convenience. First of all, is this medication indicated for whatever it is that the patient needs to be treated? And that's often easier said than done. With many of the medications, they may be studied for a particular thing when they came onto the market, but we get through experience, we learned that it can help with other things too. For example, many of you may have heard of a prescription called Neurontin or gabapentin. That medication was originally developed and studied for people who have epileptic seizures to help reduce the number of seizures that they have. Well, as it was being used, they came to realize that it also helped decrease diabetic neuropathy, the pins and needles feeling that people would get in their fingers and toes because of nerve damage. And now 90% of the prescriptions we fill in pharmacy for this medication aren't for epilepsy. They're for dealing with diabetic nerve pain. Another really common example that you've probably heard of is Viagra. Viagra was originally developed to help with people who had certain kinds of blood pressure problems, but an interesting side effect came up. And that's now it's used for erectile dysfunction. It was actually a side effect of that medication, has now become its primary use. So again, we want to make sure that medications are being used correctly for the patient. We want to make sure that they're effective medications, and by checking the efficacy, what we're doing is we're monitoring. If you're taking a blood pressure medication, then we want to monitor your blood pressure. So we always want to make sure that the drug we're giving you is actually doing what it's supposed to do. And with safety, we think of the side effects. If a side effect of the drug affects a patient so much that they can't take the medication anymore, then it's really not helpful. So we want to make sure that medications are beneficial to the patient with the least amount of side effects. So where do drugs come from? These days, prescription medications they go through a lot of testing before they get to us in the pharmacy world where we're dispensing them to patients. And some of our medications have been around for a very long time, and some are very recent discoveries. Some of the older medications, I'm sure many of you have heard of how penicillin was basically developed from moldy bread that got left in the pocket of a lab coat and discovered that it had these properties. Some of our chemotherapy medications have been plant-based. In the old days, many of our medications were plant-based. And what we've done over the years is refined that chemical that came from the plant so that we've taken away some of the side effects that could happen with the plants, plant-based and refined it so that the synthetic derivatives don't have all of the side effects, as well as they have a more consistent profile for how well they get absorbed, how well they work in the body. So that's why many of our new products are synthetic rather than plant-based or natural-based. And even a lot of the herbal products that you find are because they're plant-based, people who have seasonal allergies and problems with hay weed and hay flowers, hay fever and that type of thing, they actually can react and get allergic reactions from the natural products. So we have to be wary of that. So medications come from many different resources. Thankfully, we have some great researchers out there who are constantly looking at chemicals and finding out what kinds of things that they can do to help our population. So just to talk about drug prices just a bit, these days we're hearing lots and lots of press of these exorbitant price increases, and frankly I wonder how some people can sleep at night. But what's happening is that these small drug manufacturers are getting bought up by the larger drug manufacturers, and they're not producing as much drug as they used to, and it's creating a lack of supply, so that increases demand and that increases the cost. But for the most part, most of the drug manufacturers are also trying again to find those new chemical entities that can be used to help to treat people and to help benefit people from the medications. That being said, the drug manufacturers are making a lot of profit, and unfortunately, some of them have been very unscrupulous in the last few months, and it's led to a lot of notoriety with that. But to bring it into perspective, those are the exceptions and not the rule. Most of the drug manufacturers are staying about that 18% profit, not the 200 and 400 as some of the recent news shows would lead you to believe. So where do manufacturers spend their money? So for every dollar that's spent in healthcare, and we've just moved on to the next slide, for every dollar that's spent on buying a prescription medication, about 73 cents of that dollar goes right to the manufacturer to help deal with the costs of bringing that product to market. And we'll talk about that in just a little bit. About 24% goes to the pharmacy, and that's to cover salaries and heat and light and the cost of doing business. And then we get our medications from a wholesaler, so they take their cut too. So that's about where your healthcare dollar goes when it comes to the pharmacy. And pharmacy is about 14% of your healthcare dollar. Most of the other hospitals and clinics and that sort of thing get a much larger portion than what's spent on prescriptions. The sad thing for me as a pharmacist is when I look at that next column and I see how the dollar gets spent at the drug manufacturers. A lot of times you'll hear the manufacturers say, well, we need to charge these high prices because we're paying for research and development of the hundreds of chemicals that never made it, that didn't work out the way they thought it would do. And so they've wasted time and money on that. So they'll say, you know, we need to spend more money on that. But when you look at the breakdown that one of our professors, Dr. Schondelmeyer, that's his expertise, is looking at this sort of thing, you'll see that the biggest chunk of money out of that dollar for the prescription product actually goes to advertising. And this is the direct-to-consumer advertising that you see on television or a magazine. You can't even pick up a magazine these days without seeing drug ads in it. And the actual amount that they spent on doing that research and development is much less at only 21%. So they are putting money into research and development, but by far the price is going into advertising. And the advertising is both a blessing and a curse. There are patients out there that may not have realized that there could be something that could help them. So having the advertisement lets the patient know that they should go in and speak to a doctor about what's going on. Conversely, it also brings to patients into the physician who should not have those drugs, and the physicians have to spend that time educating the patient why they shouldn't use that drug. So again, it's a blessing and a curse when it comes to direct-to-consumer advertising. Also in the old days, or I should say even as late as 5-10 years ago, there used to be a lot of drug sampling that was basically free drug that was given to providers to share with their patients so that they could have a trial of the medication to see if it worked for them. That has gone away more so than, I think there's still a few places that can do drug samples, but for the most part it's hard to find those samples these days. So that helps keep some of the costs down. But why these are so expensive too is when they are researching a product, many of the medications, the chemicals, they are researched for 5, 10, 15 years before they even come to market, where they have a chance to recoup some of their costs. So for the first year or two, they go through computer generated modules while they're testing the medication, the chemical, to see if it will do what they hope it will do. Once it passes the computer generated modules, then it goes on into animal studies. And usually they study they put these chemicals into mice or rats or rabbits because they're relatively inexpensive, and physiologically their bodies mimic the human body, so it gives a chance to see how these chemicals might react in the human body. Now they'll spend a year or two doing those types of things, and if all goes well, then it gets introduced into the human population. And what they'll do is they'll put they'll do a drug study at a university, and they'll put up signs in the hallway and recruit these healthy young people to come into the lab. And what they're testing for is they're testing to see what kinds of side effects happen when a healthy young person takes this medication. So even though they may be developing a medication for a frail young or a frail older woman in her 80s, they'll test it on a healthy young 18-year-old guy who's at the best health of his life. And again, they're just looking for side effects. They may spend 6 months to a year testing in that population. If all works well and things seem to be going okay, then finally they will introduce that medication into the population that it was meant to help with. And this could be, again, 10, 12 years into the development of this chemical. And if all goes well, then it gets where it can go onto the market, and any provider can write for this prescription for any reason. And so you see when these medications get on the market, they've gone through 10, 12, maybe even 15 years of research, but we still don't know everything there is to know about those medications. So those first couple of years that they're out on the general market, we learn a lot about the medications and how they really work in the body. And so oftentimes I don't recommend that patients try that brand new drug as soon as it's available. Many times these drugs are what we call me toos, M-E-T-O-O-S, because we already, in 80% of the time, we already have drugs to treat whatever it is this new, latest, greatest drug is treating. But this one may be formulated in such a way as you only have to take it once a day instead of twice a day. And a lot of times it's better to use the older ones until we really know how the new ones are going to work. But if you're in a situation where you've tried all the older drugs and that's not helping for you, well, then this newest drug might be helpful to you, and that's the situation where I would encourage people to try the new drugs. Okay. So as you can see from the next slide, our major drug companies that are listed, we have Lilly, AstraZeneca, North, Merck. These are our big manufacturers, and this is pretty typical graph on how many products they have in the pipeline and how many chemicals that they might be working on at any given time. And for every drug that makes it to the market and does well, there's hundreds to thousands of chemicals that never do. So very much the fact that not every chemical that they try gets to market, very much the opposite. So clinical trials are done, now what? That's the slide we're on now. The other thing I want to mention is when it comes to long-term drug studies, many of the medications that are being developed are meant to be used for chronic disease states, so that a patient might be taking it for 10, 15, 20, 30, maybe even 50 years, depending on what the condition is. These drugs were never studied in the body for that long. Drug manufacturers consider a long-term drug study to be 6 months. So again, as I tell my family and my patients, unless there's a reason, you should not just jump to the latest, greatest medication just because it's available. There should be a reason why you want to change. So that's on the drug. When they come up with a new drug, they have a patent on that drug for 20 years, where the drug manufacturers can exclusively print or sell a chemical entity as a prescription drug product. And again, of that 20 years, 10, 15 years of that might be used up in the clinical trials. So they may only have 5 to 7 years to recoup all those costs before that 20 years runs out, the patent runs out, and now generics can be made available. And the difference between generics and brand names is that the generic manufacturer didn't have to pay for all that research and development. They can get the recipe for making that brand name medication. It may have a different color, it may have a different shape, it may have the different fillers that make the tablet big enough to hold on to, but the actual active ingredient has to be the same as the brand name. When you swallow the pill, it has to dissolve and it has to work at the same rate as the brand name. It has to get metabolized and eliminated from your body the same as the brand name in order for them to be able to sell that as a generic alternative. Now, it may vary within 5 to 10%, that's the industry standards, but it has to be very close to being the same as the brand name. So when it comes to whether you should take generic drugs over the brand name drugs, there's really no reason not to be using the generics, unless of course you might be allergic to a color or a filler or something like that. But for the most part, the medication should work just about exactly the same as the brand name. And for 95% of the medications that are out there, there's no reason not to use the generic. For some medications that have a very narrow therapeutic index, and what that means is that the effective dose and the toxic dose are very close together. Sometimes that 5 to 10% difference in how the medication works could be so close that it could cause a problem. So for those very few medications, you have to be careful that you don't start with the brand name and then switch to the generic, or start with the generic and then switch to the brand name. You want to stay with the same product that you start with. And then of course we monitor those medications very closely to make sure that everything is working correctly. So bottom line, there's absolutely no reason not to use generic medications. They're much more of a cost savings than the brand name, and you should get the same efficacy as the brand name. They just might look a little different, might taste a little different, but the effectiveness should be the same. So I'm going to take just a quick little stop right here to check in to see if there are any questions, and for letting, maybe Sandra, you can read the little cartoon I included.
Yes, the cartoon says, my teacher says little girls can grow up to be anything they choose. Why did you choose to be an old lady? And let me ask you, Dr. Bastianelli, 2 questions.
Okay.
One is regarding supplements. Are there generic brands of supplements? And as you were recently focusing on, are the ingredients the same as the brand name?
That is an excellent question. So when it comes to supplements, you want to be assured that you're getting what the package says that's inside the capsule or the tablet or whatever it is that you're getting. And many of the herbal supplements, vitamins, all that sort of thing, they really don't go through a lot of testing. So you want to make sure that you're buying from a manufacturer that has some independent testing done to know which products have what they say on the label is what is in the tablet. So very important to look for independent testings, and these come as seals of approval. But buyer beware, the manufacturers will make up their own seals. So the seals that you want to be looking for are seals that say USP for United States Pharmacopoeia, CL, which is Consumer Labs, or NF, which is National Formulary. These 3 are independent labs that the manufacturers pay them to test their products to verify that what's in the bottle is in the bottle. If you're sold on a product that don't have these 3, I mean that's the best thing to do is look for those 3 labels, and it'll be on one label for whatever. No product will have all 3. It's one or the other. But if you have the other manufacturer that I feel strongly has a good product is Nature Made. That's found in many pharmacies. They do have one of the seals. I can't remember which one. But if you buy a product, you always want to buy from the same company so that you hopefully are getting consistent. But the best advice that I have to give is make sure they have one of the 3 seals I talked about, Consumer Labs, USP, or the NF, National Formulary. Great question.
Good. The second question is, have you heard of a cancer medication that is being used to treat lupus?
I have not, but that doesn't mean it's not out there. It's just not on my radar screen.
That's it for now. Thank you.
Okay. So back to the slides. Just, again, the role of the pharmacist, we want to make sure that you're getting the most important effectiveness out of your meds that you can. And so many of our pharmacists these days can do a whole lot more. And we want to make sure that, again, you get to know your pharmacist because they can help make sure that not only are you getting the effectiveness out of the meds, but also hopefully preventing problems from hurting you in the future. So talk to your pharmacist. Again, the question about the lupus and the chemo drug, some pharmacists are going to be more in tune with that type of thing than others. Talk to your pharmacist. Ask your pharmacist that question. If they know that you're looking for those types of answers, as a pharmacist, I would delve into that and look it up for you and see what I could find. I can't do that right now, obviously, because I'm busy with this, but if, whoever you're going to, see what their interest is, see if you can get more information out of your pharmacist. Those are the kinds of things we can look up and do some research on and really hopefully help you out. So, which goes on to our next slide where we have our medication therapy management sessions. And this is where we sit down with patients one-on-one and have a chance to answer those types of questions for you, or at least find out about the questions so that we can look it up and answer it for you at another time. But we sit down and look through the medications that you're taking right now, going through every one individual, again, prescription and non-prescription, to make sure that all of those medications are doing what they need to do for you. And this would be the opportunity where you could ask the pharmacist to, again, look further into those medications that you've maybe read about or heard within your support groups to see if they're an option for you. Without knowing all of the other medications that you're on, it's really hard for me as a pharmacist to say, oh, this would work really well for you. But when you sit down with a pharmacist who's looking at your individual profile, they'll be able to help better and make those decisions. So as part of the MTM process, we go through an assessment piece where, again, we're looking to make sure that you're taking the medications correctly and that you're understanding how to take the medications. There are times I've seen patients that don't take a medication at the right time. There's medications to help prevent stomach upset that if you don't take it a half an hour before eating, before breakfast in the morning, the medication doesn't work. It actually needs the anticipation of the acids in your stomach. As you're anticipating eating, your acids start getting released into your stomach, and that's actually what turns the medication on. So if a patient isn't getting relief from a patient, to find out, or from a medication, to find out, okay, what's going on? How can we make this better for the patient? I once had a patient who had having a lot of problems with stomach upset, and what it came to be is this patient had seen on TV that from the Florida orange growers how drinking orange juice could decrease your risk of having certain cancers. Well, this person had a strong family history, so he started drinking orange juice every day. Well, the problem wasn't that he was drinking a glass of orange juice every day. He was drinking a gallon of orange juice every day. And that affected his stomach, and it also affected some of his other medications. So again, making sure you're talking with the pharmacist and telling them how you're taking your medications and what a typical day seems to be for you to get the most out of your medications. Next slide, where we're talking about the appropriateness of the medications. I've had patients who've called in to get refills for medications that they don't even take. Here a patient, her spouse had passed away and she didn't want to waste the expensive medication, so she started taking it. So again, things happen. My own husband, who is a very educated man, didn't read the prescription bottle and ended up taking a medication that was meant for me. So again, making sure patients read the bottles each and every time, make sure that you're taking the right medication for you. We want to make sure that patients keep their medications in the original vials. The vials come in brown vials to help protect medications. When we leave the cap off, or when we pour the medications into another dispensing type system, if they're not being protected from heat and light, the medications can break down and not work the way they're supposed to be. Many patients store their medications in the bathroom medicine cabinet, right? Because that's what it's for. Well, in the old days, when you took a bath once a week, whether you needed it or not, then that was okay. These days, with many of us having showers and some, some homes having multiple showers in a day, then having medications in the bathroom is not a good place. You want to make sure medications are stored in cool and dry area protected from heat and light. So, again, we want to make sure that the medications are good when you need to take them, that they're working the way they should be. So very important how you store your medications. So when it comes to medications, and now we're talking about the risk factors for drug effects, adverse drug effects, you'll see at the very top of my list polypharmacy. Again, anytime somebody's taking more than 5 medications at a time, you're having a chance where those medications will react with each other. So very important that you talk to a pharmacist, get to know your pharmacist, because we can help minimize those types of effects. Again, be aware, the more doctors you go to, the more they tend to see your disease rather than the person as a whole. So just keep reminding them about, how will this react with whatever else you have going on. If you're on any kind of, honestly, when it's for treating lupus, I would not recommend people combine alcohol with these medications. Alcohol is the world's oldest muscle relaxant. But it has a lot of drug interactions, has a lot of problems with the liver and with the stomach, as well as crossing the blood-brain barrier. And so lots of interactions when it comes to alcohol. Best to abstain from alcohol. Another factor is we want to make sure that when people are taking more and more medications that they stay well hydrated to keep your kidney function working properly. Again, many times people will just take medications with just a swallow of water. That can actually hurt your kidneys. So really important to drink a full glass of water each and every time. So moving on to the next slide, it's the physiological implications of drug therapy. Basically, when we're born these sacs of water, and as our bodies age, we change physiologically, and that's fine when we're younger. And but as we start to get into our 40s, 50s, 60s, 70s, 80s, and so on, our bodies are physiologically changing, and it changes how medications get absorbed and how medications get used in our body. So really important that even though you've been on a medication and been well controlled for years, still important that we go to the physician and go to the provider regularly, because things can change pretty quickly as we get older. Our livers become less efficient at clearing out medications, so a dose that you used to be on and it worked great, well, now as we get older, that medication could become toxic because your liver's not clearing it out like it used to. Same thing with the kidneys. If we don't have good kidney function, the medications that we're taking can stay in the body longer and actually accumulate over time and become toxic. So very important that our physicians are monitoring our output, our input and our output when it comes to kidney function. And again, protecting your liver by not drinking alcohol is very important when you have other medications that you're taking. The next slide kind of got messed up with the formatting. But basically, when it comes to kinetics of the drug, it's not just swallowing the pill, having it dissolve and getting it into your circulatory system, where the pill goes out to your toes, out to your fingertips, up to your brain. And when you take these medications, what these medications are doing is they're going through your system, and you can kind of think of it as a lock and key. The pill that you're taking is the key, and it's looking for the right lock. And we call those locks receptors. And sometimes the key will go into the lock and it'll block a reaction from happening. Perhaps you've heard of beta blockers for treating high blood pressure. Other medications, the keys will go in and it'll turn the lock and open it up, and that will actually start a chemical reaction to do what it needs to do. So that's how medications get into the system to work, but then they also go through a process where they lose their effectiveness or they wear off, and we need to get rid of some of that so that all these keys don't junk up the system. And that's where the metabolism and excretion comes in, where we're metabolizing the drugs to not make them active anymore, and then they get eliminated out our body through our kidneys, through our liver. So that's why liver and kidney function is very important, that we monitor and make sure that those are working as effectively as they can. So in summary, again, I hope over the course of this last 45 minutes that I've hopefully encouraged you and given you some evidence on why it's important for you to get to know your pharmacist. We can help answer some of those questions you have about your medications, especially when it comes to drug interactions. And anytime you have, again, a chemical coming into your body, you get good effects and bad effects, and we want to get the best out of those effects that we can. So I want to take just a quick break just to see if there are any other questions before I go on to the next section to finish up.
Yes, a couple questions. Do all pharmacies and pharmacists embrace the medication therapy management?
I would say yes, especially the younger pharmacists. This is something we stress very, very much so in their education system. We are really fortunate. Minnesota is at the forefront of pharmacy services. And, you know, not to toot our own horn, but I will, we are now currently ranked number 2 of all the pharmacy schools. There are over 130 pharmacy schools in the U.S. We are ranked number 2. And it's because of our focus on medication therapy management and helping patients get the most out of their medications.
That's great. The second question is twofold. Does insurance cover consultation with pharmacists? And B, how might one go about accessing the pharmacist?
Excellent. We are, again, very fortunate in Minnesota. Most of us have insurance coverage, and most of those insurance companies do cover medication therapy management. So what you could do is call the 800 number on the back of your card, of your insurance card, and inquire if your particular insurance would pay for that. And then what you could do is contact your local pharmacy to see if they provide MTM services, medication therapy management services, and if you know, you would need to make an appointment with the pharmacist then to sit down and have that uninterrupted time with the pharmacist.
Thank you.
Excellent. So now the next slide is something I include because I think it's really important for parents, for grandparents, anybody who's taking chronic medications to realize who else might be taking your medications besides yourself, especially when it comes to pain medications or that type of thing. Kids today, unfortunately, have gotten into some bad habits where they consider prescription drugs to be safer than the stuff they get out on the street. So they have, they'll have parties where each of the kids will grab some pills out of grandma's or mom and dad's medicine cabinet, which shouldn't be in there anyway. They'll go to a party and throw it in a bowl and then just grab a couple and take them. So they have no idea what it is that they're taking. And they call them farm parties, they call it skittled parties. So just crazy things that the kids will do because they think it's safer than buying marijuana or pot out on the street. So it's crazy stuff. And you can see by the next graphic with the prescription abuse, this trend is just growing exponentially. I have a 16-year-old son, and it just scares me to hear about some of the things that he's told me about how his friends, what they're doing. Thankfully, hopefully, I've given him enough information over the years so that he doesn't get caught in this, but we all know how peer pressure is, and please, please keep your medications where others can't get at them, because if you see it, then the pie chart that I have there, over 70% of the supply of these types of medications are coming from family and friends. They're not buying it out on the street. They're getting it right from home. So very important that people are aware of who might have access to your medications, or if somebody comes in or your friends of your kids come in and they have access, they might be pilfering some of these still medications for, unfortunately, for scary things. Here, I'm in Duluth, and here in Duluth we're seeing an incidence in the amount of heroin use that's happening with our kids. And part of it is these kids aren't getting a hold of the Lortab or the Vicodin like it used to, because there are much more stringent controls on that. But that means these kids are looking to the street to get their opium fix, and people are dying. So really important to, again, be aware of who has access to your medications. It's a scary thing. So what do you do with those medications when you're no longer taking them? I have a quote here by Oliver Wendell Holmes from 1894 saying, if we would throw into the sea all the drugs we know, it would be so much better for the patients and so much worse for the fishes. And that's true. Here, again, I live on Lake Superior, and our waste treatment plants can't handle medications being flushed into the toilet. So please do not do that any longer. If you need to get rid of medications, some of the local police departments actually have med take-back boxes. Some of the local waste management systems have med take-back days where you can dispose of the medications properly. Worst case scenario, if you need to get rid of a medication, put it into that amber vial, crush it up, add some coffee grounds or add some water so it's all icky and ucky, keep it in the plastic container, tape it up with duct tape, and throw it into the garbage. It's actually better for it to be in the landfill than it is to go, again, down the sewer. So that brings me to the last couple of slides. Again, just some general safety tips. Make sure you read the label each and every time you take a medication, so you're always knowing you get the right medication. Keep a list of your medications and non-prescription medications, those over-the-counter things, with you at all times. Anybody who has a chronic condition, if you happen to get into an accident or if you have some kind of event, if you have that list of medications on hand, that can really help the paramedics boil down to what might be happening, or at least they'll know what other medications might be in your system. So really important to have a current, up-to-date list of medications at all time, and of course never ever ever share meds. So nobody takes care of you better than you. Again, I hope in the course of our time this afternoon I've empowered you to make sure you seek out your pharmacist, get to know them, build a relationship so that you can have that another advocate in your corner when it comes to your medications.
Thank you so much, Dr. Bastianelli, for sharing your expertise and the use of cartoons, which gives us a sense about your sense of humor, and for providing a wealth of information about understanding and using medication wisely. I think, as you suggest, people using medication can be informed, can be active, and can be empowered participants in their healthcare team. So thank you very, very much. I want to thank everybody else for joining us today for this webinar. Please go to our website, lupusmn.org, for more information about our services and our events. That concludes the webinar, and I will be stopping it right now.